So the anti-IL-5 therapies we'll be discussing refer to the biologic therapies that are currently approved for management of severe eosinophilic asthma, and specifically the drugs that we're talking about are mepolizumab, reslizumab, and benralizumab. And these drugs work by blocking molecules along the IL-5 inflammatory pathway, which is involved in eosinophil production and activation. And so while these drugs have been shown to be very helpful in many patients with severe eosinophilic asthma, more recently we've noticed that there's a group of patients that, though they look like they should be the correct phenotype to respond to these drugs, don't actually have a good clinical response and continue to have asthma exacerbations and symptoms despite initiation of these drugs. And so it's this group of what we call non-responders that we're really interested in studying at the University of Colorado, and kind of are the basis of what I'll be talking about tomorrow. So tomorrow I'll be discussing the current data around patients who don't respond to anti-IL-5 therapies. And I'll preface by saying that there's not a whole lot of data out there right now, but I will try and cover the current predictors of anti-IL-5 therapy response that we know about, as well as try and discuss some of the predictors that we're looking into, and then discuss possible mechanisms that may be driving anti-IL-5 therapy failure.